Lisa Marie Kosas of Global One Health. This video is another example of a hip car drill. As I referenced, cars are controlled articular rotations and are very commonly used to improve mobility in certain joint structures, especially in the hip. The first video addresses the sideline hip car, which is the most modified variation that you can do as you're in a sideline position so the body is fully supported by the ground, so there is minimal to no gravitational compression on the spine and on the body and joint structures overall. The next version I'm going to talk about today is a quadruped position of a hip car. So definitely a progressed variation, or a progression as we would call it, because you are weight bearing. So if you're looking to build strength in the shoulder girdle complex, a nice way to multitask is to do a hip car in this quadruped position. It's referenced as quadruped, but you actually begin on 6 points, 2 hands, 2 feet, and 2 knees. I'm going to be in a dorsiflexed position of my ankles. And while I do break down in previous videos the importance of how to support yourself in this quadruped position, one quick general note when you're focusing on that rotational movement in the hip is to not just start to forget about what you're doing in the upper body. Don't sink into the shoulder joints. Remember, the goal always is to push the ground away from you. So that's very active in its static position, very active in its dynamic energy. Hands are not flat. I'm kind of gripping the ground. I always reference corkscrewing the upper arm into the socket to lock into the rotator cuffs, and I pack my shoulders. So once I've set all those 3 points in my mind, is my supporting myself most properly in that position. My core, of course, is very much engaged, and I want to think about pressing the ground away from me. So I'm going to do the same rotational movement I did in the sideline variation in that other video here in the quadruped or on all fours, hands and knees. So I'm going to begin, and I can start forward or backwards. It doesn't matter which direction I start in per se. I'll just start working forward. So forward is the right. So there's a combination of sagittal plane movement, leg moving into flexion and extension, overlapped with that rotational transverse plane movement. So I begin by pulling my thigh into towards my forward arm, and in hip flexion, I slow motion move the leg out into external rotation, and then I start to work back into hip extension as I work on internal rotation of that thigh. And now I can come back down if I want to make that full circumduction, right? Or just from here, I can focus on just pausing in that position and returning from there. Now, I'm internally rotating. I'll show you from an anterior view so you can see a little bit the angle, a little bit better of internal rotation, but I'm trying to pull my knee in towards this other down foot. And I reverse that path. So I raise the leg back up into extension, and as I continue moving out laterally to the side, I externally rotate my leg, and then I return back forward into that center hip flexed position. One more time, I'm going to go forward, up and around, externally rotation as I pass through abduction into internal rotation and extension. So when we talk about extension, right, I want to actively use the glute muscle group in the posterior side of my hip to drive, right? I'm really thinking about driving that heel up towards the ceiling as I move in through extension and then come back around. So just so you can see from the anterior view, the shifting, but again, the controlled movement is very specific so that I want to make sure that everything else except that one moving joint is completely stationary. So just from the anterior view, when you're thinking about the weight distribution here, right, a very general rule of thumb is when I lift a leg off the ground, if I'm seeing this or feeling that lateral shift in my body, that is technically a compensation, and I'm really cheating myself on getting the proper activation of the abductors of that hip. So as much as I want to focus on mobility of that joint structure, I do need to be mindful of what's happening in the rest of my body to control and prevent, right? That's where the control comes in, preventing movement anywhere else in the body. So I have my joint structures, everything set up. You can see the corkscrew from a different angle, the pushing the ground away, packing my shoulders. And I'll use the other leg now. So I'm going to go into hip flexion. The knee is coming forward, as you saw, towards that arm in parallel position. So I'm now starting in flexion. Then I move into external rotation. as I continue that circular pattern, because circular represents the rotational pattern, I am now moving into hip extension, and then trying here, you can see that internal rotation a little bit better from this angle. And then I'm going to reverse that and go into external rotation as I bring the leg back around, passing through abduction into hip flexion. So the point being, what I'm really trying to avoid, again, is that lateral shifting. That is a compensation, as I referenced, and you're selling yourself short. So the goal is to get the isometric contraction in the lateral hip. The abductors are working to stabilize the body, and you want to do that same thing when you're standing, right? So you don't want to have a huge lateral shift when going from one leg to the other. So this is why it is a progressed version from the sideline is, right, it's a long time, so you want to build up the strength endurance in the shoulder girdle, but of course, you want to make sure that the wrists are comfortable in that position. That's something to think about. You can always prop up the wrist, as I talk about putting a thin towel under the base of the wrist. But if you're looking to build strength endurance in the shoulder girdle, and if also a very important point, while we want to do weight bearing, it builds bone density for the upper extremities. Very important that we do get loading in our arm bones and on the joints of the upper extremities as a way to prevent and minimize osteoporosis and osteopenia. So building up to these weight bearing progressions is a very important way to also build bone and to increase bone density and muscle endurance in the structures. So again, avoid the lateral shift, keep those lateral stabilizers turned on the opposite hip for the moving side, and then you really are getting the value and the benefit of that controlled movement. As I mentioned, cars are great for recovery, for in between more intense workouts on your off days, great assessment tool to work on improving joint mobility overall and seeing where your joints are at, and of course, great for improving symmetry and balance in your joint structures, and that is the QUADRUPED hip car.